Pediheart, Pediatric Cardiology Today. My name is Dr. Robert Pass, and I'm the host of this podcast. I am Professor of Pediatrics at the Icahn School of Medicine at Mount Sinai, where I am the Chief of Pediatric Cardiology. Thank you very much for joining me for this 304th episode of the podcast. This past week, our field of pediatric cardiology lost one of the true pioneers when Dr. Sylvia Griffiths died at the age of 99 after a 7-plus decade career in pediatric cardiology. Dr. Griffiths was Professor Emerita of Pediatrics at the Columbia College of Physicians and Surgeons and Special Lecturer in Pediatrics at the time of her passing. She's extremely well known in the New York City world of pediatric cardiology, but is perhaps now a bit less well known outside of our region, so I'm going to very briefly review just a few of the many highlights of this wonderful lady's life and career. Dr. Griffiths grew up in New York City and attended Hunter College High School, which is even today considered one of the most competitive public high schools in New York City. After that, she attended Hunter College, graduating in 1944, and she went on to Yale Medical School, where she graduated in 1948. And it's noteworthy that she was one of 7 women in her medical school graduating class of 57 total graduates way back in 1948. She received her pediatrics and pediatric cardiology training at Yale and considered one of her greatest mentors to be the famous Tausig trainee and devotee, Professor Ruth Wittemore, who is one of the founders of our field. Sylvia moved back to the New York City region and joined the pediatrics department at Columbia in the 1950s, where she created the pediatric cardiology program with Dr. Sidney Blumenthal, who was a pediatrician and pediatric cardiologist. Dr. Griffiths was one of the first to be certified in 1960 by the American Board of Pediatrics and was considered one of its 50 founders. After Dr. Blumenthal's retirement, she worked under Dr. Welton Gersony, of whom she always spoke so fondly. At Columbia, Dr. Griffiths directed the Pediatric Cardiac Clinic from 1972 to 1990, and she remained a clinic attending even after formally retiring around that time in 1990. It was in this role that she was known to countless cardiology fellows over many decades, where fellows would present cases to her and she would teach in a kind and patient manner. She also always wanted to know what was the latest gossip in the department. Her career was so long that she really bridged that period where most of pediatric cardiology was managing rheumatic heart disease until the modern era of managing complex congenital heart disease, and she was basically friends or friendly with every major figure in the New York scene of pediatric cardiology. Outside of her work, Dr. Griffiths was a mother to her daughter Wendy Griffiths, who's a composer and on the faculty of the Mannes School of Music in New York City, and she was married for many decades to her husband, Dr. Raymond Griffiths, who until his retirement in 1983 was the executive editor of the Journal of Cell Biology, which is published by Rockefeller University Press. Dr. Griffiths had many interests, but perhaps one of her greatest was her love of classical music. And anyone who ever called her on the telephone knew that in the background would be her favorite radio station, New York's public radio station, WQXR. I've known Dr. Griffiths for the past 26 years. Interestingly, the entire time of my career, Sylvia was actually retired and was only working part-time, and yet we became fast friends, as was the case with everyone who knew Sylvia. I first got to know her because her brother had a defibrillator, and I would review the printouts from his quarterly checks, and she would dutifully take notes for her brother, who was an engineer and very interested in the specifics of his device. However, over the years, we became much better friends, and I relied on her great wisdom and kindness and humor, and I know that I speak for many in saying that I will miss her dearly. To honor Dr. Griffiths, one of the true pioneers and female pioneers of both medicine and pediatric cardiology, I thought I would review just one of the over 150 papers Sylvia wrote over her long career, and then afterwards, we're honored to speak with 2 important figures in her life. First, we'll speak with Dr. Christopher Petit, who's the Chief of Pediatric Cardiology at New York Presbyterian Hospital, and who knew Sylvia despite the relatively few years he has thus far led that program. However, I think it is fitting that someone representing New York Presbyterian speak for just a few moments about the impact she has made on that division, and will then briefly speak with one of Sylvia's very dearest friends and mentees, Dr. Christine Walsh, who's Professor of Pediatrics at the Albert Einstein College of Medicine and was friends with Sylvia for roughly 40-plus years. And so let's briefly review an article from Dr. Griffiths going back 55 years, and then speak briefly with two important figures in her life. The article we're going to be reviewing is entitled Postoperative Evaluation of Mitral Valve Function in Ostium Primum Defect with Cleft Mitral Valve, Partial Form of Atrioventricular Canal. The first author of this work is Sylvia Griffiths, and the rest of the authors are Kent Ellis, John O. Burris, Sidney Blumenthal, Frederick Bowman, and James Malm. And this work comes to us from the Department of Pediatrics, Radiology, Medicine, and Surgery from Columbia University College of Physicians and Surgeons and the Babies and Presbyterian Hospitals in New York. And this work was published in 1969 in the journal Circulation. One of the reasons I've chosen to review this article is because the senior author of this work, Dr. James Malm, who was a very prominent surgeon in the 1950s, 60s, and 70s, was a dear friend of Sylvia's, and I thought it apropos to review a paper in which she co-authored with her very good friend and colleague. Before we start this work, I think we all need to remember just how difficult it was to be a pediatric cardiologist in 1969. We heard a bit about this from Mike Freed back in episode 203 from 2022, and also from Dr. Peter Lang back in episode 176, not to mention Dr. Welton Gersony in episode 247 last year. But let's not forget that there was no echocardiography, and so the entire evaluation of patients with congenital heart disease, pre- and post-operatively, was largely based on the physical exam and maybe an ECG and catheterization. With that proviso and reminder, this work basically is looking at the outcomes of mitral valves following repair of primum ASDs with associated cleft mitral valves, or the so-called partial AV canal defect. The rationale, according to the authors, was that there was some differing literature out there in the 1960s regarding how often, following a primum ASD repair with mitral regurgitation, a patient actually would have meaningful mitral regurgitation after the repair. Dr. Griffiths and others comment on the literature from such famous authors as Braunwald and Morrow, in which significant mitral regurgitation after the surgery was reported to be extremely rare, but in other works by such giants as Lillehei, the incidence was thought to be a lot higher. Thus, it seems that there was a real dearth of information and perhaps even a little bit of controversy regarding this factor. And of course, from the perspective of 2024, this might seem like something that would be quite obvious in an era of advanced imaging. But remember that just 55 years ago, this was the state of the art: physical exam and angiocardiograms. With this as a background, the authors explain that this study was, quote, undertaken to clarify the postoperative hemodynamic status and the anatomy in this lesion, utilizing right and left heart catheterization and LV angiography. The report reviews the outcomes of 8 patients who had a repair of the ostium primum defect and cleft mitral valve, and who all had an apical systolic murmur, which was clearly believed to represent the physical exam sign of postoperative mitral valve regurgitation. The time period in which these surgeries were performed was November 1961 to June 1965, and 19 patients had surgery in that time frame, ranging in age in that time frame from 3 to 22 years. And again, this work represented the catheterization results of 8 of these 19 patients. They review how catheterizations were performed 1 to 3 years after the operation, and how patients who were under 12 got the dreaded DPT, or Demerol, Phenergan, and Thorazine injection, which of course many may have forgotten, but was a very common concoction given to children as a sedative to get a child on the table prior to the procedure to sedate them. This was, of course, in an era when using an anesthesiologist was considered a rare thing and even a sign of weakness for the cardiologist who was expected to sedate their own patient. In any event, Dr. Griffiths and colleagues describe how they performed right heart caths, measured wedge pressures and cardiac index using dye dilution technique, and also how they performed retrograde left-sided caths, followed by an LV angiocardiogram in biplane. And on to the results. The authors explain that the pre-op caths on all the patients showed QPQSs ranging between 2 to 1 and 4 to 1, with most having normal systolic pulmonary pressures, but 3 being elevated at above 30 millimeters of mercury. In the 5 of 8 who had an LV angiogram preoperatively, there was mitral regurgitation seen in all, but the authors mention that with the angiograms all performed prograde from the RA to LA and LV across the mitral valve, it was hard to know if this was technical related to a catheter across the mitral valve or real mitral regurgitation. However, all the patients had an apical systolic murmur. They review the surgical technique and describe repairing the cleft in the anterior leaflet of the mitral valve, regardless of whether there was a clinical suspicion of mitral regurgitation. And they mention that the subadjacent chordae tendineae were not resected, and the ostium primum defect was closed with Teflon. And now the important finding: what actually happened after surgery? Well, first they report that the chest x-rays showed that all the heart sizes had decreased to normal or near normal, with the exception of one case where there was a tremendous amount of subaortic stenosis following surgery. All 8 of 8, though, had an apical systolic murmur graded between 2 and 4/6, and the one patient who had subaortic stenosis also had an additional harsh systolic murmur at the left and right upper sternal borders. 7 of the 8 had normal right and left-sided pressures, with the exception of the case of the patient with the subaortic stenosis, who had a 75 mm peak systolic ejection gradient recorded at cath, and the authors note that preoperatively, this patient had a 26 mm gradient, and when looking at the angiograms, there is a suggestion of some sort of additional subaortic ridge or membrane that can be seen, and the images are in the paper. And what about the mitral regurgitation, which was the single most important question and perhaps the reason or rationale for this review? Well, 8 of 8 had a systolic murmur in the apical region, and yet at LV angio, no one had more than minimal mitral valve regurgitation with angiography. And the only one who had any mitral regurgitation had a very high LV pressure due to that subaortic ridge, and there's a nice image of this LV angio in that patient for review. In their discussion, the authors review how apical systolic murmurs were heard in all the patients after surgery, and how in most it was even louder than pre-op, and yet angiography clearly showed there to be almost no mitral regurgitation in anyone. And so they state that the reason for this apical murmur wasn't clear to the authors, and they wondered if more modern cine angiograms or phonocardiograms might elucidate the mechanism, clearly not anticipating the role for ultrasound in just 1 to 2 decades. The authors mention how the absence of mitral regurgitation after surgery would seem to support the surgical technique described in this work of repairing the anterior leaflet without resecting any of the subvalvular apparatus. They speak about the appearance of the LV outflow on the LV angiograms and minor differences in the contours of the septal surface of the LV. And they mention that it is their belief that though AV canal defect patients can develop left ventricular outflow tract obstruction, in the one case they had with severe obstruction, it was likely more a separate entity of a subaortic ridge, and they mention a case report of someone with this constellation of findings that had been reported prior to this report. They end the work by reminding the reader that LV outflow obstruction was seen in their one patient, and this was not seen prior to surgery, and so this should be something that all cardiologists who are monitoring a post-op partial AV canal should surveil for. Well, I don't think there's much to say about this. I think it is certainly interesting to see how limited the cardiologists of that era were in their ability to assess anatomical features of children with congenital heart disease from a technical perspective. But really, it's remarkable how much they ended up knowing about these patients' anatomy with what would today be considered crude testing, such as auscultation, electrocardiography, and angiography. And yet, I think we all see how the old-time cardiologists and surgeons of the past, like Dr. Griffiths and Dr. Mom, were able to figure these things all out without the technology that we all rely so heavily on. I'm sure that the advent of the echo was an extraordinary change and an exciting one for Dr. Griffiths, and how amazing that she bridged the era from almost no technology, including no catheterization, to an era that we have today with fancy echocardiography with Doppler, as well as mind-blowing cross-sectional imaging with 3D reconstructions. I'm not sure I could have personally been a cardiologist in that era, and it is a testament to her clinical training and intellectual curiosity that Sylvia could continue to work and evolve in the field, which was certainly so very different at the time of her retirement in the early 90s in comparison to her earliest days as a cardiologist in the 1950s. At this point, I think we should move on to hear from Dr. Christopher Petit about what an impact Sylvia made on the program at Columbia. Christopher Petit is the Welton Gersony Professor of Pediatrics at NY Presbyterian Hospital, Columbia University. He completed his medical training at Vanderbilt University, followed by pediatric residency at Northwestern, and this was followed by cardiology training at the Children's Hospital of Philadelphia. It is a pleasure to welcome Chris back on the podcast to discuss his longest-serving faculty member, Dr. Sylvia Griffiths. Welcome, Chris, to Pediheart. I'm here now with Dr. Christopher Petit, the Chief of Pediatric Cardiology at New York Presbyterian Columbia University. Chris, thank you very much for joining me this week on the podcast.
It's a pleasure to be here, Rob. Thank you for having me.
Thank you. Real pleasure to have you, and a real honor to honor our mutual friend, Dr. Sylvia Griffiths. Chris, I was wondering, you've been the chief for a couple of years, but not there very long yet, and I'm wondering if you had the opportunity to speak with Sylvia during your time as the chief, and wondering if she ever offered you any words of wisdom in your role there as the boss.
It's interesting that you asked that question, Rob. She did reach out to me back in 2020, 2021, when I first arrived, and I didn't know much about New York. I certainly was not as well educated about the glorious history of pediatric cardiology at Columbia, and she actually called me through my assistant, Joanna Del Monte, and she gave me a long history on the phone of her involvement, and she is so devoted, and she really wanted to pass on to me how special this place is, and what an amazing faculty, surgical team, nursing team we have here. And I got the sense from those conversations of the legacy. That was the first hint that I had of the legacy that Dr. Sylvia Griffiths sort of had at Columbia, and all the amazing things that she's embedded into this program.
Yeah, sounds like Sylvia for sure. Well, for those in the audience, Dr. Petit was away last week, and I'm bothering him right in the middle of a busy day. I'm sure he's got a million things to take care of, so I don't want to take up very much of his time. But as you know, Chris, Dr. Griffiths was a huge supporter, just as you described, of New York Presbyterian, and particularly pediatric cardiology at NYP for obvious reasons. I'm wondering if you might be able to speak as the chief of the division about the role that Dr. Griffiths played in the cardiology program, and what do you believe her impact was in a career that spanned over 7 decades at New York Presbyterian and Columbia for both your own program, but also pediatric cardiology and medicine in general?
Well, Rob, I don't know how much time you have left on this podcast to go into it. I could spend a couple of hours, and you could fill in a lot of the details. I don't know, but suffice it to say, she was here at the beginning. You know this better than I do, that she started pediatric cardiology at Columbia in the 1950s. In fact, she went down, as you know, down to Hopkins to work with Helen Taussig. She was one of the very special, talented, motivated women who decided to make a field where there was no field of pediatric cardiology. These were infants and children who were left to be, cardiac cripples and to not survive. And she and Helen Taussig and many others in that early formative time decided to create a field and to pester surgeons until they would finally offer surgery for these infants and children. And she created that here in the 1950s with Sidney Blumenthal, and created the program. So everything we've done thereafter, and she had a big role to play in the 60s and 70s, as you know, in creating a pediatric cardiology program, a congenital program, training the very first pediatric cardiology fellows. She was, as you know, one of the first 50 board certified or board recognized from the American Board of Pediatrics pediatric cardiologists in the country, one of the first 50. Wow. Yeah. Amazing stuff. I'll say her legacy continues. When her brother died, they gave a large gift to Columbia so that we could have a visiting professor once a year. And I'm so lucky that we were able to get a visiting professor in this past May. Dr. Dan Lish came through and spent a couple days with us honoring her legacy. She was able to call in and sort of be present via the telephone for one of the lectures that Dr. Lish gave. And I'm proud that we're able to get one last visiting professorship in, and she could really enjoy it.
Wow, well, that's a wonderful memory. And I think I remember Sylvia telling me about that actually sometime in early June when she and I spoke. I think it was that lectureship that was established even way back when I was still at Columbia was something that she was extremely proud of, because I think it appropriately recognized the importance of teaching, which always was I think if you asked most of the people who knew Sylvia after her wonderful good humor and all, it was the amount of teaching that she did, and really brought on not just the next generation, but maybe 4 generations of pediatric cardiologists. Well, Chris, I can't thank you enough for taking a few moments from your day to recognize our mutual friend and person that we both admired so dearly, Dr. Sylvia Griffiths. Thank you so very much.
Thanks so much, Rob. Have a great day.
You too. As our final conversation about Dr. Griffiths, I thought it was no one who would probably be better suited to speak with than Dr. Christine Walsh. Dr. Walsh is Professor of Pediatrics at the Albert Einstein College of Medicine in the Bronx, New York, and was a dear friend of Dr. Griffiths for over 50 years, first being her fellow and then eventually a close friend. I, of course, have had the distinct pleasure of working with Dr. Walsh for well over a decade during my time at Montefiore, and she's well known in the field of pediatric electrophysiology. It is a delight to welcome her to the podcast to speak about our mutual friend Sylvia. Welcome, Chris, to the podcast. I'm here now with Dr. Christine Walsh of the Children's Hospital at Montefiore. Chris, thank you so much for joining me this week to talk about our mutual dear friend Sylvia.
Well, thank you so much for asking me to do this. It's truly an honor and a pleasure to talk about my dear friend Sylvia.
Thank you. Well, you know, Chris, I know, having worked with you for well over a decade, and of course I know you for about 30 years now, I know you always were very, very dear friends with Sylvia. I'm wondering, how did you meet her, and how did your relationship develop over the years?
Well, you know, I met Sylvia during my internship and residency in pediatrics at Babies Hospital, now known as Morgan Stanley Children's Hospital. But I really became close to Sylvia as my professor during my fellowship in pediatric cardiology. Sylvia's door was always open, and, you know, you could see her in there, sometimes smoking a corncob pipe.
Oh, God.
It was incongruous, but Sylvia could pull it off. Anyway, I loved popping in, and Sylvia was so welcoming. But importantly, she lived around the block from me when we lived in Yorkville. So she drove me to work every day. I don't think many people know that, but Sylvia drove me to work every day. And Sylvia drove as she spoke, slowly and deliberately, which gave us plenty of time for great discussions about pediatric cardiology and, more importantly, about life. Sylvia even gave me a wedding shower in her apartment during my fellowship. And Sylvia was like that. She was always kind. She was generous. She was supportive. You know, she was my teacher, my mentor, but most importantly, she was my very close friend. And she became a source of support and guidance for over 50 years. I was so happy that my daughter Kathleen had her as a teacher during her fellowship in pediatric cardiology at Columbia. And it just gave me great joy to know that she benefited from Sylvia as well.
That's a wonderful story. I had forgotten the whole corncob pipe thing, Chris. Those of us who know Sylvia, it's hard to imagine her with the pipe in her hands, but she was quite the character for sure.
Well, when the first time I saw her with her pipe, I was a little taken aback, but, you know, Sylvia could just pull anything off, really.
I bet. Now, Chris, I know that you and Sylvia are both graduates of Yale School of Medicine. Did you think that helped connect the two of you?
Oh, absolutely. Absolutely. Sylvia graduated from Yale in 1948 with 7 women in her class. I graduated from Yale in 1973 with 7 women in my class. So this created quite a bond. And on top of that, Sylvia and I had the same reunion cycle. So she and I would drive up together to New Haven and would have a great weekend up in New Haven. And she was very proud of being a Yale grad, and she was always interested in my activities, especially when I was on the board. And she did her pediatric cardiology fellowship at Yale before joining the faculty at PNS. And she was truly a pioneer, and I'm sure you know this, Rob, but in 1960, she was named one of the 50 founders of the Subspecialty Board of Pediatric Cardiology. And she directed the cardiology clinic from 1972 to 1990, and she became a professor of clinical pediatrics in 1977. So she taught at Columbia over 70 years. I mean, she is a pioneer. And in addition to all her clinical work, she published over 150 scientific publications. So Sylvia was truly an amazing and gifted clinician, scientist, and teacher.
Yeah, you don't have the advantage of having heard my little introduction to this week's podcast, but I make the observation that when I started as an attending at New York Presbyterian in 1998, Sylvia was retired about 7 or 8 years, working part-time as a clinic attending. So my entire friendship with Sylvia postdated her years as a full-time pediatric cardiologist, and yet still we became very, very good friends. And I just think about how long 7 decades, it's really quite remarkable, truly a blessing. Chris, you probably were closer to her and amongst her professional friends than just about anybody. And I'm wondering, when you think back on Sylvia, what is it that you most remember? What is it that first comes to mind when you're thinking of her?
Oh, well, that's clearly her memory. She had an amazing memory to the end. And we would talk about people, and I would struggle over a name, and she would come up with it, whether it was a patient or a colleague, and she'd come up with that name while I was still struggling to remember. And the next thing I remember about her is that she deeply loved classical music. I don't think I ever talked to her when she didn't have QXR in the background.
That's for sure.
She constantly listened to classical music. It was fantastic. And in keeping with her Yale system of education, she remained a lifelong learner. And she took courses at Columbia and at Hunter College in subjects such as art history and opera. So she was very eclectic. She also enjoyed many decades of witty conversation with her late husband, Dr. Ray Griffiths, such a wonderful guy. I had the privilege of knowing him fairly well, too. And until his retirement, he was the executive editor of the Journal of Cell Biology. And they were so well met. They really were. They also had in common that they loved and took great pride in their daughter, Wendy, who is a musician and a composer. And Sylvia told me a funny thing. It sort of took me a little bit aback at the time. She told me that Wendy and Ray shared a love for the movie Animal House. And if you know Wendy and Ray, it sort of is surprising. But this was such an interesting family, really. A wonderful, wonderful family.
Wow, what wonderful memories. Chris, for those in the audience, Dr. Walsh was nice enough to speak with us fairly in the early evening, so I'm going to wrap it up here and just ask you, having worked with her and being her dear friend for so many years, what do you think you learned from Sylvia about being not only a good physician, but a good friend and mentor?
Well, Sylvia was my mentor, my friend, and actually my hero. She taught me about taking care of patients and about taking care of the family, friends, and colleagues. She had the extraordinary ability to make patients feel that they were all that mattered. And the same was true when she was talking to a friend or a colleague. She sincerely cared about people and was amazingly perceptive and wise. And she taught me to be honest, caring, and open-minded. And I truly feel that I am standing on the shoulders of a giant.
Well, better words couldn't have been spoken. Chris, I want to thank you very much for joining the podcast this week and sharing your wonderful memories of our mutual friend and friend of so many people, Dr. Sylvia Griffiths. Thank you so much.
Thank you, Rob.
Pleasure. To conclude this 304th episode of Pediheart Pediatric Cardiology today, I did not have to struggle at all in thinking of an appropriate ending to our brief tribute to my friend and yours, Dr. Sylvia Griffiths. we'll hear the magnificent German lyric tenor Fritz Wunderlich sing the beautiful 1826 song by Franz Schubert, aptly titled On Sylvia. This lovely and beautiful song starts, "Who is Sylvia? What is she? That all our swains commend her. Holy, fair, and wise is she. The heavens such grace did lend her, that she might admired be." I wish you all a good week of inspiration from the memory of the wonderful Professor Sylvia Griffiths. We are all the richer for having known her.
Was ist Sylvia? Saget an, dass sie die weite Flur preist. Schön und zart sich sie nahen, auf Himmels Gunst und Spur weist. Dass ihr alles untertan, dass ihr alles untertan. Ist sie schön und gut dazu, reizhaft wie milde Kindheit. Ihrem Aug heilt Amor zu, dort heilt seine Blüte.